interrupt your programming to bring you a joint news conference held by Medical Center Hospital and Odessa Regional Medical Center. This is an update on COVID-19 cases from the hospitals. We're still waiting for that news conference right now, so we'll take you there live when that happens. There have been a total of 7 COVID-19 cases in Odessa. The mayor and judge yesterday saying 8, but we got it confirmed today from the health department. It is actually 7 cases. In Ector County, there are now a total of 29 cases in West Texas, 3 more cases in Midland as of today, bringing the total in Midland to 16 cases. All right, let's listen in to the news conference.
Yeah.
We're waiting on Brandy.
Yeah, well, she should be, but I mean, if we need to get started, just go and we'll slide her in. As long as somebody can let her in.
All right, I've got 3 o'clock. Let's do this. Y'all ready? All right, good afternoon. Thanks for being here. Of course, I'm Russell Tippin. I'm the president and CEO of Medical Center. And thank you for being here today. Stacy's here, so we have both the hospitals here. We have our county judge here, our chief medical officers here, and we appreciate y'all being here. I just want you to know that we are planning on doing this every day about this time, 3 o'clock, especially as this is ramping up, just to give some good information out to our folks and get some good numbers and data out there to answer any health-related questions. We'll attempt to do that during these times. So I know that you guys are running around a lot chasing all these press conferences, so we'll try to keep ours at the same time, try to get our press releases all going out at the same time, just to help keep things simple for everybody. If that works for us, we'll keep that going. If we find that it's interfering with other things, then we'll adjust on the fly. But right now, we plan on trying to keep this around 3 o'clock every day, Monday through Friday. So before we get started, I just wanted to kind of talk about what we intend to do here today. As this situation has kind of spread across the nation and across Ector County, Stacy and I talked when all of this got ramped up, and we knew that we have a healthcare lane to stay in, and that's what we wanted to do. Wanted to make sure we were in our lane when it came to the incident command and to all the emergency work that the mayor and the county judge and everybody's doing. And now that this has kind of shifted over into the healthcare side of it, that's why we kind of feel like on the healthcare part that we need to do this pretty frequently just to get some good data out there. But we're definitely team players in the system. There's a food chain, if you will, of how this flows. And Stacy, I want to tell you thank you for all our phone calls, and we've talked more in the last 6 to 10 days than we have in the last 20 years. So, but it's been now that this thing is shifting more towards healthcare, we'll be pumping out the information to you guys and into our community and make sure we get some good numbers out there. Want to send a good word to our friends also at Midland Memorial. They are doing some extremely good work over there. Mr. Myers and his crew have done an outstanding job, have set the bar very high, and I know we want to send our thoughts and prayers to them and their staff. I'm sure they're as tired as our crews are, and we want to give them some encouragement and tell them to keep up the good work and keep fighting the good fight and keep providing great care for your patients and for West Texas. So our thoughts and prayers with Midland as well as everybody else in the world fighting this. Personally, I just want to take a quick moment to say thank you to my family. They're putting some long hours in, I know, just like everybody's family is. And we wouldn't be up here if it wasn't for the support of our family and our community just as a whole, as our family. Just thank you. But for my wife and kiddos, and I know for y'all's families, we want to say thank you for the time and for the late nights and the early mornings and the text messages in the middle of the night and oh, have you seen this on Facebook? And just, we want to say thank you to our loved ones for supporting us and getting us through this. And we love y'all very much, and we appreciate y'all loving us. The number of tests at Medical Center, I just want to update a few things. Number of tests completed in the hospital or urgent care is 60. And these are pretty hot off the press numbers. The number of positives in the hospital, we currently have 3 in-house positive, with one of those hopefully being discharged home this afternoon. So that would be a good win for us all. I know Stacy has some information on their patients as well, but a discharge would be a great win home. So we're hoping that that occurs this afternoon. We have number of negatives, we have 12. Number of pending cases, we have 8. And the number of pending approvals in our facility is 21. So those are pending. And so that's the most up-to-date that I have right now. One thing we've talked about as a facility is if we get a lot of tests hung up at the state level, we're going to give that some time, and if that doesn't move appropriately, then we'll probably move to an outside lab to help advance that on and get those test results a little more quick. We know that things tend to bottleneck, and we just want to make sure that we don't want tests hanging out there. Nobody does for a long period of time. So if we get some tests hung up, we're going to go straight into a private lab with that. Let me just talk a little bit about our CCU and our 7 Central are all our precautions are taking place. Those are kind of our isolated floors. We've got people we're putting in there that are under suspicion or the positives. Those all are properly staffed up. Those are properly ventilated. I know that's been a big question we've had about what about reverse air and keeping everybody safe. Those are all going just fine. We have rooms, ante-rooms before you go in there that have negative pressure so we can get everybody geared up and ready to see the patient. All our PPEs, all our personal protection, are launched on all our floors. I know there's a nationwide shortage on masks and shields, and the groups that have been making masks for us, we appreciate that. Thank you very much. We're all working, every entity in the world is working to find avenues to buy more N95s and more masks. You'd be surprised how suddenly there's all these people who sell masks now. And so we have to vet those out carefully. But at the same time, you've got some very reputable companies out there that make good products that I know we're taking advantage of those folks and getting some good pricing from them, and that's going to help get those shipped in here pretty quickly. In Medical Center right now, there's 175 people in the hospital right now, so that's just our whole body count in the hospital. We have 32 ventilators not in use, so that's good. That puts us in pretty good shape. And we are working with our staff just to make sure that all our people that are at risk or all our people that are going to be coming in contact with these patients are ready. We're even talking about aftercare for our employees, you know, to be able to talk to professionals and just make sure we decompress everybody after we take care of our patients, because our health of our employees is very important. The mental health of our employees is very important. And we just want to make sure that not only we're protecting them with the equipment, but also we're protecting their mental health and their physical health at the same time so they can give good care in there to our patients. Let me say a few more words about, I want to thank Representative Landgraf, Brooks Landgraf. I know he takes all our phone calls every time we call him, and he's been a real trooper and a rock star in this deal, and he has got the best interest of West Texas and his district in mind, and I want to send him a special thank you for what he does for us and just helping us out and being available anytime we need him. Also, wouldn't be doing a good job if I didn't recognize other people like our respiratory therapist, housekeeping staff, phlebotomists, the people that work in our pharmacy, everybody that's putting in time and effort to help not only take care of the COVID patients, but also the regular patients. I mean, there's still babies being born and appendix that need to be taken out, and there's still things happening outside of the COVID. And so we've got good folks working on those patients too. So I just want to say thank you to all those people that aren't necessarily in the line of fire, but they're still working, providing care to these regular everyday patients that we have in there as well. Also, thank you to the Medical Center Board of Directors. They have been fantastic. They are letting us do our work. They're there when we need them. We sure do appreciate their support and their help and what they're allowing us to do. And they've just been very good folks, and they're helping us make our job a little easier. So with that, I'll turn it over to Stacy and let her update you on her numbers.
Thank you, Russell. We really do appreciate the partnership of the two facilities being able to work together, and many of the points that Russell raised are the same things that we're doing at Odessa Regional Medical Center, so I don't want to duplicate much of that. What I will do at this point is update you on some of our testing results as well, and then I'll hand it over to our Chief Medical Officer, Dr. Sarah Vannon, to update you on a few of the other things that he wanted to speak of. So as of early today or mid-morning, we've tested a total of 37 patients. We've had 5 who have been positive for COVID and received another negative today, so we now have negative numbers of 7. We're still pending results on 25 patients. In terms of what's actually in the hospital from a COVID or PUI person under investigation perspective, we have 2 in the PUI unit that we're waiting on the testing to come back, 2 who are in the hospital who are confirmed and in our ICU. We did discharge 1 since we met yesterday, so that's good news, as Russell said. We're always very excited to be able to say that we've sent someone home to complete their recovery there. I do want to at least echo Russell's sentiments in terms of the appreciation to the community, the tremendous outpour that we've received from people at all levels to support our leaders and, most importantly, our frontline staff. It is very much appreciated, and they do really need to hear that, and so keep it coming, because that's part of what keeps them going through a crisis such as this. We are also providing them, of course, with resources, as Russell said, for mental health as well, because they're really the ones that are taking the brunt of it, being on the front lines. With that, I'll hand it over to Dr. Sarah Vannon just to add a few more points.
Hi, everyone. So I want to address 2 questions today. One is going to be about how to prevent yourself from getting this disease, and second is what to do if you do get the disease or you think you get the disease. So to understand the disease process first, it is a respiratory illness, which means it's spread from person to person through the air that they breathe. So that's the important thing to understand, is it's spread by droplets. So if somebody sneezes or coughs and you walk through the whiff of their sneeze or cough, that is the way you would more likely than not get the disease. You can get it from surfaces as well, which is why we talk about cleaning surfaces. But the respiratory is the major way. So the way you can prevent yourself from getting the disease is maintaining that 6-foot distance that we have talked about, to stay at home as much as possible and only to go out for when you absolutely need it, for seeking health care or for essential things at home, and to wear a mask if you are sick so you don't spread it to other people. So that's the way you're going to protect yourself. Wash your hands as often as you can. Don't touch your face. You've heard all of this before. We'll probably repeat that every single day, so it's top of mind for you, but that's how you protect yourself. So if you get it, or you think you get it, and you feel sick, the best thing to do, again, is to stay at home, is to isolate yourself from the rest of your family if you can in a room in your house, to only go out if you absolutely need to, and to monitor yourself for the symptoms that could warrant you seeking more medical care. So calling your primary care physician, for example. The things that you should call your primary care physician for is if you've already treated your fever with over-the-counter fever medications and your fever is not controlled. If you've already treated your cough, feel short of breath, or if you start to feel oozy and you're not able to maintain consciousness, for example. Those are emergencies. For those, you call 911. For everything else, you call your PCP and you discuss whether you should get tested, where you should go to get tested, and make sure that they're prepared to receive you if you are in fact sick. So those are the main points I wanted to address today. Thank you.
Come on.
Let's let Brandy go.
Yeah, Brandy, come on. Do you need to say anything?
So I wanted to give you all an update on the health department numbers and what we're doing. So the numbers that we have as of probably 30 minutes ago would be, we have 10 positive cases. We have 60 pending and 29 negative. We have a website that the community can go to. You can go to the county website, click on the banner at the top, and that'll take you to the website that will show you any updated cases. And this would be easier for the community to go to this website rather than us sending out press releases, because the information is changing so rapidly.
You know, I want to echo the appreciation to all of the medical staff. They, at this time, are really the community heroes. And so I cannot applaud them or the staff at both the hospitals, the health department, at the clinics, the physicians, and everybody that is embracing this crisis. I want to thank Stacy and Russell for allowing the health department and the county to join in this press conference. So, with that I say, I pray that you and your family are well. Ector County issued a declaration of local disaster that was put in place at 11:59 last night, hoping it would reduce the spread of the COVID virus. My office today has been fielding many questions about what is essential and non-essential services. If you're not certain, I would encourage you to first go to the Ector County website and review this list that has been provided for you. If you're still not certain of what is essential or non-essential, please feel free to reach out to my office. There have also been a lot of questions about measures being taken at Slaymire Airport. On March 26, Governor Abbott signed Executive Order GA-11, directing persons arriving by aircraft from certain specific geographic areas to complete 2 documents before leaving the airport. Those 2 forms are a form for arrivals from areas designated for mandatory self-quarantine, and the second form is the mandatory terms of self-quarantine. Upon those completions, airport staff are sending those documents to the DPS for verification and approval. The Emergency Operations Center has relocated to the County Southside Senior Center at 900 South Dixie. Again, I want to thank each and every one of you. God bless our community, Ector County, the city of Odessa, the great state of Texas, and our nation. Thank you.
Thank you, Judge. Anybody else up here need to say anything? Are y'all okay? All right. That's been pretty short and sweet, so let's take some questions. Y'all have some questions we can answer for you? Yes, sir.
Yeah, you mentioned you have 8 pending cases and 21 pending approval. Can you explain what the difference is between those?
Yes. The 8 pending are cases that are at the lab waiting to get tested. The others are ones that are at the state level waiting for the state to give us approval to send those to the lab. So that's the difference in between those.
Hey, can you clarify the number of positive cases that you have in the county right now, please?
As of right now, we have 10 positive cases.
Thank you.
All right.
I have a question for Dr. Sarah. You mentioned before that test feedback comes in differently depending on priority patients. How do you decide who a priority patient is?
Mm-hmm. So tests don't come back differently for priority patients. Tests are done whether or not you're priority. So as I was explaining yesterday, there's 3 priority levels. Priority 1 is symptomatic patients who are hospitalized and symptomatic patients who are healthcare workers. Priority 2 is symptomatic patients who have other risk factors. So either the elderly or other comorbid conditions, things that could make them sicker than normal. And the third priority is other essential care workers that are symptomatic. So to explain the test results coming back, different labs are getting us test results back in different time frame. So Russell mentioned they're sending some, they're sending all to the state lab right now, and they're considering sending some to private. ORMC has sent everything to private labs right from the very beginning. We started sending them specifically to LabCorp first. The first specimen, in fact, which is still pending today, I think is day 12 now, that's sitting somewhere in California at a LabCorp lab waiting to be tested. And I think it's because of the high volume that they have. But then since then, they've opened another lab in Dallas. So now we're getting them back in a shorter period of time than before. CPL is the other lab that we are recently sending it to, and we're sending all our priority ones to CPL because CPL is turning them around in 24 to 48 hours. So I hope that answers the question.
Ms. Garcia, I had some questions for you. I wanted to ask, the other week there were a lot of issues that the county was talking about as you guys were having some trouble getting testing numbers from the private labs because there's some miscommunication there, bypassing y'all to go straight to the state. Have you guys sorted out that issue and gotten those numbers from that?
The private labs, the private providers, they will be sending us their numbers on Tuesdays and Fridays. So every afternoon, then we would have those from those physicians.
And so far, you gotten the ones that y'all didn't have beforehand?
Yes.
Okay.
Great. What else? Yes, sir.
Saw some questions on Facebook Live, Mayor Turner's Facebook Live earlier today, referencing what medicines people should take for colds or fevers. Some people were saying that if you think you have coronavirus, you should not take Advil. Is there anything you can speak on that?
Because a lot of the symptoms between flu, coronavirus are very similar respiratory symptoms, a lot of over-the-counter respiratory treatments for decongestion and finer such. There are some probably studies that are ongoing that are discussing the use of ibuprofen-based products that don't do well with COVID, and so probably refraining from that type of medication. But again, a lot of these medications for over-the-counter respiratory sinusitis and such have a mixture of medications in there, so you need to be very, very cautious about what you're actually taking. Read the labels on those to make sure that these medications don't contain an ibuprofen substance that's made up of those medications.
Are there any that you advise people take?
I don't have any by name. I mean, do you have?
Sure. So most over-the-counter cough and cold medicines will be safe to take during this. Most fever medicines will be safe to take during this disease. The important thing to realize is that this disease is so new. We don't know enough about it, and we are making guesses in the scientific community. So you'll hear us sort of drag our words a little bit when we're answering these questions, because we don't know for sure what will work and what won't work. But we're giving you the information that we think we have from the scientific community so far. Ask us 6 months from now, and we'll give you definitive answers. But for now, this is the best information we have.
Just to reiterate, for people who were here at the beginning of the press conference, Medical Center has 3 positive patients currently in their facility. ORMC has 5, correct?
The numbers are 4 currently.
4 currently.
5 positive, 4 in-house.
Yes, sir. Can we address that real quick about these positive cases? You know, we like to talk about the numbers and the number of positive cases we have. Probably what really needs to be emphasized are those that are in the hospital and those that are being treated at home. For the community to recognize that right now a majority of these positive cases are at home and being treated under quarantine, and that's very, very important for recognition that what we're doing in a community standpoint, self-isolation, staying away from individuals is as important as anything else. That's what keeps our numbers from being in the hospital a little bit lower than such. So please don't get fixated really on the total number of cases, but what that distribution of the cases are with regards to how many people are hospitalized and how many people are not hospitalized. You know, we're really lucky here. Our numbers are still low. Again, that may change, but if we look across the country, we hear a lot of numbers. Well, what do those numbers actually mean? when they're hospitalized, they're using up PPE for us. They're requiring people, healthcare workers, to be at the bedside a little bit more than normal, and so those numbers can be skewed when you don't know exactly what you're talking about.
Dr. Davenport, can you identify yourself just for the
Yeah, I'm Don Davenport. I'm Chief Medical Officer, interim, and Chief of Staff at Medical Center Hospital.
Dr. Davenport, I also wanted to talk about the asymptomatic carriers.
Yeah, go ahead.
Okay. So the one other thing to address is asymptomatic carriers. There are people that have the disease that will show no symptoms at all, and that's the majority of people. The young, healthy folk will not show any symptoms from the disease, but they can still spread it, which is why we talk so much about social distancing and isolation, because if you don't do that, then you don't know. You may have very good intentions, but you don't know that you're spreading the disease to someone else because you're young and healthy and don't have any medical conditions, so perhaps you have no symptoms. So I hope that that's another reason why you understand why we push social distancing so much to the community.
Okay, and sir, I've got one more question. Yes. I'm not sure if this is even really answerable, but do y'all have like any kind of rough guess, based on the number of cases that you guys confirmed, how many asymptomatic people might be floating around in Ector County who don't know they have it?
It's a hard question to answer because there's no test for an asymptomatic carrier, but we can only make educated guesses based on the data that we have from countries that are, or places that are ahead of us on timeline, right? So on timeline, they have more cases, they've gone through it more, there's more people that have recovered. Just by looking at those, we talked about yesterday how 80% of the people will probably recover fine without needing any care. A big percent of those 80% are probably going to be those asymptomatic carriers. So you do the math with the numbers that we gave you. There's a lot more people in the community that have it that don't know that have it right now.
And is there any update from yesterday? You said that there was 2 in-house patients that were on a ventilator.
They're still the same right now. Yes.
All right, good questions. Anything else we can answer for you?
I had a question for the county judge. Is she still there?
Yes.
I want to check and see who's in charge for distributing the information for the number of cases in Ector. Because yesterday there was some confusion at the press conference that there were 8 cases, but there were actually 7.
It's because there was one patient that was double counted when we were gathering our data before the press conference. But as soon as the press conference was over, that information was corrected. Anything else? All right, thank you.
On that patient, you can credit me for that one. One tested over at RMC and then was sent home and then didn't get improved and then came over here and we admitted. So that's where that came from.
Got double dipped.
Yeah.
I got a question about that, actually.
Yeah.
If someone is being released, let's just say that patient, they felt better, they went home, they got sick again, is that what happened?
Yeah, I think I know from, I'll talk about what on the medical center, then I'll turn it over. I think what you see is you have people that come in and get tested, and as you heard from the docs today, the recommended treatment is to go home. And then if you go home and you're not feeling better, then you need to follow up with your primary care. And I think that's exactly what happened in this case. And so I don't think it was anything more or less than that, but this person was following the recommended treatment plan, got home, some time went by, wasn't feeling better, and I don't know, maybe it's a shorter drive over here than, I don't know. We don't know what that was, but the recommended treatment is staying home unless you stop feeling worse, and then you contact your provider. Good enough?
Yes.
What about the homeless? Is there any medical staff that's being deployed to like the Salvation Army or out in the streets to try to give them information?
Anybody have any information on that? We currently don't have anybody deployed out into the community, but at all these urgent cares, I know with ours and with Stacy's, anybody's able to walk in there anytime, and so there is care available should they choose to go to one of those urgent care centers. Yes, sir. Did you have another one? I'm sorry.
Oh. You're looking behind me? Okay.
No, sir. Sorry.
I wasn't sure. So between both hospitals, how many folks are like in the ICUs and how many people are hooked up to the ventilators?
Go ahead.
We have 2 in the ICU and 2 on vents.
We have 1 in the ICU.
And then no one on ventilators here?
That's good news. That's good news. All right. Anybody else? Again, our goal here today is to get good information to you as the media and to the public who are listening. We'll keep this going until we feel like we're just probably are just repeating ourselves, but we'll do this every afternoon, 3 o'clock until further notice. And if you have any questions or anything you need from us, just let us know. And we sure do appreciate y'all being here today. Our message is wash your hands, stay at home, wash your hands, and stay at home. So if no other questions, then y'all have a good afternoon. Yes, sir.
A couple more. Sorry, I just thought I'm a little bit late.
You always do. You know, you always do.
Sorry. But part of like the policies for like the hospitals is to not let in visitors and restrict them as much as possible. What are y'all going to do in cases, I mean, God forbid, hopefully that doesn't come to it, if a patient looks like they might pass and they might not be able to save, as far as them getting visitors for, family to say goodbye to them?
Yeah, that's a very, very important question that I know we're getting a lot of. And we're trying to keep that exposure to a minimum. And I know we're providing wristbands, 1 per customer, 1 per patient. But at that time, so we have a couple areas like the labor and delivery, end of life, that we are trying to make good accommodations for people to be able, so when their loved one's going through this. But we've got it notched down very tight because we want to make sure we're not endangering anybody else in that. And believe me, it's a tough situation to talk about because I know that if it was my loved one laying in there in the life, man, I'd be hot if I wasn't able to get in there. But we are doing our best to try to get the appropriate amount of people and make sure that we are ultimately taking care of all of them. That's a tough situation.
And then last one I had, this was touched on a little bit at the conference we had just before, but as far as like the masks that were donated, the ones that were made, like the fabric ones, do those all like work just as well in most like the situations, or are they only able to use it in certain?
Yeah, you know what? Let me hand that off to Kristen because she's a mask pro, so I'll let her talk about that.
I don't know about the mask pro. So currently there are no studies that say whether the cloth mask is as good as a surgical mask. So we are just enforcing our staff to go ahead and wear those because, as we all know, something is better than nothing. And even the CDC guidelines are starting to start saying things like, well, wear a bandana if you don't have a mask. It's always something to put a barrier between you and the patient in regards to the shared air and the coughing and aerosol treatments and things like that.
So at this point, like it's something, but you're not sure if that actually would stop like the virus from spreading to
That's correct, because we haven't been in this long enough to know that yet. However, a lot of our people that are exposed to those COVID positive patients, or for those people under investigation, they're wearing their cloth mask over the surgical mask or the N95. So they're not only wearing the cloth mask, they are wearing the personal protective gear they're required to wear, and then those are covering that as well.
Are you sure that's it?
I think so.
All right. Thank you, folks. Have a great afternoon. We'll see you tomorrow.
All right, that was MCH and ORMC holding a joint news conference this afternoon. Well, we are learning now 10 confirmed cases in Ector County. The doctor, Don Davenport, says the majority of cases will be treated at home and in quarantine. Right now, we have 7 in the hospital in Ector County out of 10 patients. Dr. Sarah Vannon with ORMC says asymptomatic carriers are those who do not have symptoms and are carrying the COVID-19 and can spread it. He says 80% of people will heal without care. We now return you to regularly scheduled programming.